appreciate this bipartisan inquiry. I think that while no doubt medication can be one appropriate tool in a treatment plan for some children, it has instead become the first line of consideration for too many children in our foster care system. The Congressional Research Service looked at the year 2010 and found that 40% of children in longer-term foster care over the age of 6 were using psychotropic medicines. That's a pretty staggering level. Other studies found the next year in 2011 that those who are enrolled in Medicaid, children in foster care, were prescribed psychotropic medications at rates of 3 to 11 times higher than non-foster children. The pill is not the answer in many of these situations. Having been abused or neglected and then removed from their homes, every child coming into the foster care system has suffered some degree of trauma. We've heard firsthand in this committee about the problems with psychotropic drugs a couple of years ago and continue through our research to see other examples of that. And we've heard firsthand from foster children about the trauma and how it has impacted their lives. This issue was addressed in this committee when our colleague, Chairman McDermott, chaired the committee back in 2008 and required states to develop health oversight plans for children in foster care, including the oversight of prescription medicines. In 2011, Congress strengthened that provision to include specific protocols for reviewing the prescribing of these medications to foster children. I look forward to hearing from each of our witnesses on how child welfare and Medicaid policies have changed in response to these specific laws. My home state of Texas, with the leadership of CASA, the Court-Appointed Special Advocates, recently changed the law there and took a number of steps to prevent unnecessary overmedication of children in foster care, including the legislation that will give guardian ad litems a greater role in the oversight of these medications. Improved oversight of medications is only part of the solution. Children in foster care need access to comprehensive treatment for mental and emotional health needs, which requires additional efforts in both the Medicaid and the child welfare system. I appreciate the presence here today and the leadership for this hearing from our colleague Karen Bass of California, who heads our foster care caucus. The administration's budget calls for $750 million over the next 5 years toward this goal. This is an investment that is equal to about 1/4% of one of the measures that our committee approved earlier today. I believe that we do need to come together with common purpose and hear of any ways we can change the law in this area, but we also have to have the resources present to be able to get the job done effectively and not just respond after some crisis or horrible situation has hit the news media. Thank you, Mr. Chair, and I look forward to hearing from all witnesses.